think I was just more shocked because I had cancer. And it's the one thing that you never want to hear. And when it's verbalized to you, I think regardless of age, you know, it's going to take you back and cause you to really think long and hard about what do you do to go forward.
I didn't want to have a mastectomy, but my husband and I talked about it. If we had to, we would. But I just thank God I didn't have to go through that. So I'm very grateful.
And after they explained what the Contura was, my husband was with me, and we looked at each other, and I looked at him, and my comment was, this is a no-brainer. I can't imagine why anyone would want to go through 6-7 weeks full breast when you can have it done in 5 days, 2 times a day, and you're finished.
My job is as an assistant principal at a middle school with 12, 13, and 14-year-old children. And so it was important during my treatment that I was able to be on campus, working with the kids, working with the teachers, and making sure that the school functions and runs.
I listened to all my options as far as treatment was concerned, and then I find one that fit my lifestyle the best and that had good results and that would work for me. And fortunately I was a candidate for the Contura, and it did exactly what I'd hoped it would do.
These are just some of the thoughts that a woman who's been diagnosed with early-stage breast cancer may have. Nearly all women diagnosed with breast cancer require some form of surgery as part of their treatment. A mastectomy, in which the entire breast as well as surrounding muscle, tissue, and lymph nodes may be removed, was once the only surgical option for breast cancer patients. Today, however, there is an alternative that exists for many patients, which is called breast conservation therapy. Breast conservation therapy consists of a lumpectomy and radiation therapy. A lumpectomy has now become a commonplace procedure in which the cancerous tissue and an additional rim of tissue surrounding the cancer are removed. This is followed in most cases by radiation therapy, which targets the remaining cancer cells, hopefully preventing them from reproducing or spreading, reducing the risk of recurrence. Statistics show that when a patient has a lumpectomy followed by radiation therapy, her survival rate is the same as if she had a mastectomy, with the benefit of being able to keep her breast. There are 2 modes of radiation that can be given. Whole breast irradiation uses a radiation source outside the body, which focuses energy through the skin to treat the cancer site, and is usually given over a 6-week period. Alternatively, accelerated partial breast irradiation, or breast brachytherapy, most commonly delivers radiation through an applicator placed inside the breast to specifically treat the tissue surrounding the lumpectomy cavity, and is given over a 5-day period. Because you are watching this video, your doctor has identified you as a candidate for breast brachytherapy, utilizing the Contura multi-lumen balloon breast brachytherapy device from Cenarex. The Contura multi-lumen balloon is a small, state-of-the-art device implanted into the breast, delivering a radiation seed that is sent through 5 separate lumens or channels contained within the balloon, allowing the doctor to contour the radiation treatment to the tissue surrounding the lumpectomy cavity.
I asked my doctor when I initially went in, what are my options and what kind of treatment are available to me, and what does he recommend is the best treatment for me considering my diagnosis?
That's a great question, Joyce. Almost every patient asks me that question. And following surgery, by having radiation therapy performed, it gives you the same cure rate as having a mastectomy, removal of the breast, and you're allowed to keep your breast with this therapy. In performing radiation, there are 2 options. One is the traditional type of treatment called external beam or whole breast radiation therapy, which takes about 6.5 weeks to complete. The radiation treats the entire breast tissue and also exposes some of the chest wall and lung to radiation. The other treatment that patients are very excited about along with physicians is called breast brachytherapy. It's a treatment where we can deliver the same type of treatment as whole breast, but is performed in a 5-day period and is concentrated or localized just to the area where the tumor was. The treatment takes 5 to 10 minutes twice a day and is like having an x-ray at the hospital. You'll feel the same way when you leave the office after each treatment as you did when you walked in. It's not going to make you sick or nauseous or lose your hair or any of those side effects.
If I were your mother, what type of treatment would you recommend for me?
A lot of patients ask me that, and also a lot of patients come to me wanting the 5-day treatment. And from a patient standpoint, it's very convenient, and that's what the patients really like. They can carry on their normal activities. A lot of patients continue to work during the treatment. But from a physician standpoint, I really like the fact that the radiation is localized to the tumor area, and it does not expose the rest of the breast or other parts of your body to radiation, and we know that's very important. So if my mom was in your situation and had to make this decision, I would prefer brachytherapy for her because she could live her normal lifestyle and have a reduction in radiation exposure.
If we're going to radiate, let's radiate where the cancer was located. Let's get to the point of where the tumor was, and let's attack it from the inside.
Before the introduction of Contura in 2008, some patients who were possible candidates for brachytherapy were excluded because the location of their lesion was too close to the skin or chest wall, which would have caused too high a radiation dose to these healthy tissues. The Contura multi-lumen balloon breast brachytherapy device was developed to address this problem by using 5 separate channels to place the radiation seed, allowing the physician to better target the prescribed amount of radiation to the areas in most need of treatment, limiting radiation exposure to healthy tissue and organs.
When I was talking with my radiation oncologist about, the different types of options for me based on where my tumor was located, how close it was to the skin, I knew I wanted to do the radiation internally. I felt that was the best way to go about it. The one and only product that was available for me, the Contura, was what was chosen, and I'm glad that that product was available and is available. Otherwise people, like me, who do have the tumors close to the skin, are going to miss out on something that, in my mind is the best choice.
In some cases, another problem may arise when fluid and air become trapped between the implanted balloon surface and breast tissue. When this occurs, the standard procedure has been to send the patient home for a few days in the hope that the fluid or air will absorb into the body, which could delay the completion of the treatment schedule. Contura offers a unique solution to this problem by incorporating vacuum ports on both ends of the balloon, enabling the physician, in most cases, to easily remove the fluid and air from the lumpectomy cavity, keeping the treatment schedule on time. Additionally, the Contura's vacuum suction allows the balloon to fit closely within the often irregularly shaped lumpectomy cavity, allowing for the targeted areas to receive the best possible treatment coverage.
I prefer the Contura brachytherapy catheter because of the ability to shape the dose, and what that means is with traditional brachytherapy catheters, we did not have the ability to limit the dose to the skin or to the chest wall. With the Contura and the 5 lumens within the balloon, we can customize the treatment for each patient, and that really is a benefit. It reduces the risk of radiation exposure to other parts of the breast and body.
The Contura 5-day treatment plan. Placement. Typically performed in the doctor's office 2 to 3 weeks following the lumpectomy procedure, the Contura balloon is placed inside the breast. Once inside the lumpectomy cavity, the balloon is inflated with saline solution until it fits snugly within the cavity and will remain inflated inside the patient's breast during the 5-day treatment. Once the balloon is inflated and in place, gauze padding is placed around the catheter and taped down so that the patient can move around freely between treatments.
After the catheter insertion, while the patient's going through treatment and the balloon catheter is in their breast, there's actually very little pain involved with that, and patients can perform their daily activities and go on about their lifestyle as they normally would for the most part, without any discomfort or pain.
I was worried that I might have pain or that it would be uncomfortable, that I couldn't get dressed properly and go anywhere, and that was totally untrue because I was able to go out and I shopped, and we went to dinner, we went to a movie.
The pain was minimal for the insertion. They do a good job numbing you up, so you're not going to feel, everything. There's a tugging and a little bit of pulling and all that stuff. Just given where my tumor was, it was very close to the skin, and so mine was a little bit more delicate in terms of the insertion where the surgical cavity was. But other than that, once they got the balloon put in and they inflated it with the saline, you couldn't really tell other than, the little bump, as I said, with the balloon being so close to my skin.
The Contura 5-Day Treatment Plan. Treatment. After the Contura balloon is placed, a CT scan is taken to verify the position of the balloon within the breast. A customized treatment plan is developed for each patient to determine the specific locations to place the radiation seed. The portion of the balloon applicator that is outside of the breast is then connected to a high-dose rate radiation computer-controlled device, also known as an HDR. During treatment, this device automatically transfers a radiation seed from inside the machine through tubes and into the balloon lumens. As a result of where the seed sits in the balloon lumens, the radiation dose is custom contoured for the specific lumpectomy cavity. Once therapy is complete, the seed is removed and the HDR is disconnected from the balloon. Between treatments, the patient can return to normal activities without the concern of being radioactive or exposing others to radiation. The patient visits the radiation oncologist twice a day for only a 5-day course of treatment. Each treatment takes approximately 15 minutes from setup to completion.
Most all patients actually go through the treatment without any side effects. There is a small risk of bleeding or infection or a radiation-type sunburn effect to the skin overlying the balloon. And there is a small risk of scar tissue development within the breast long term, but in general most patients tolerate those side effects fairly easily, and most patients actually don't have any side effects.
My treatment was excellent. I mean, I was just thoroughly surprised at how easy it was. I would arrive in the morning. They told me wear comfortable clothing, and I did. They did the ultrasound on me, and then took me from that room into the radiation where they did the radiation. And it probably took less than a half an hour, and I was ready to go home.
Easy. It was very easy. It was just like a piece of cake. I couldn't believe it was done so soon, each treatment. And the worst was for me going twice a day back and forth and waiting in the waiting room. That was it.
And I would get up in the morning, go have a treatment before I go to school, go to work. The treatments themselves, maybe 10 minutes from start to finish. The actual radiation time was much less than that. Painless. You couldn't tell anything was going on. There were no side effects. My skin didn't get red. There was no itching. There was no burning. There was nothing out of the ordinary in terms of, having this treatment done. And so after the 10 minutes, you go back to work, you do what needs to be done throughout the course of the day, you take care of your business, you take care of living your life. Go back in the afternoon, same thing, 10 minutes, and you know that you're that much closer to beating this.
And it was done. About a week later, my husband and I took a trip to Italy for 2.5 weeks, which he had planned, and I was real concerned whether I was going to be able to, we were going to be able to go or not. And doctors said, go ahead, you're good, don't worry about it, just go and have a really good time, and we did. We had a wonderful time. So anyone who's traveled to Europe knows how long those flights are and everything, and I managed just perfectly well.
The Contura 5-Day Treatment Plan. Removal. After the 5-day course of treatment, the Contura balloon is deflated inside the breast and gently removed. The incision is then closed with a bandage. Most patients report little or no discomfort during balloon placement or removal.
We like to play golf a lot, and I had to tone it back when I first had my surgery, but now I'm back and I can do all the things I did before, and we can go out